Hello, let me introduce myself. I'm Nick and Olivia, students from Faculty of Dentistry, Universitas Gadjah Mada. And thank you for the opportunity that is given for me. And I will presentation about my paper entitled Platelet Homologous Platelet Plasma Induced Osteoblast Proliferation. Okay. Introduction. Periodontitis is an inflammation of the tooth supporting tissue caused by specific microorganism that result damage in periodontal tissue. The goal therapy of periodontal disease is periodontal regeneration and proliferation. Regeneration of bone formation begins with cell proliferation, and proliferative activity could be influenced by growth factor and cytokine. And platelet plasma have received attention in regenerative therapy because contains various growth factors and clinically enhance new angiogenesis, tissue repair, and regeneration. Platelet-rich plasma is divided into two types regarding the source of blood collection, namely autologous platelet-rich plasma and homologous PRP. The problem with autologous PRP is when the patient have bad medical history or patient has a hematological disorder that can affect the outcome of autologous PRP. And so, in homologous PRP, derived from healthy blood donors and the donors that have been screened. And it has several advantages, such as ease of preparation, high platelet count rather than therapeutic ratio, and low cost. And freeze drying is a method to increase the storage time of homologous PRP and maintain the growth factor contained therein. PRP can be preserved by freeze drying without loss of non-healing properties and contain various growth factors. And to avoid infection, support the bioactivity and storage of empty PRP for a long time, PRP must sterilized with gamma radiation. There is a study which states that sterilization with doses of 25 kg and on PRP not detected bacteria colony. So in this study we use doses 20 and 25 kilograms. And beside PRP, there is another platelet concentrates recently introduced that is injectable platelet-rich fibrin or IPRF. Some study compare IPRF with PRP against fibroblast, osteoblast, antimicrobial efficacy, and IPRF show the better result, but not yet compare FDPRP and IPRF. So in this study, we use IPRF as positive control. And then we move to material and methods. This research was a laboratory experimental research. We use sample MG63 cell line, osteoblast cell lines, divided into three treatment groups. FDHPRP 20 kg, FDHPRP 25 kg, and IPRF as a positive control group. So methods, this is methods from freeze-dried homologous PRP. Donor blood bags were taken from a blood bank in Indonesia, Palang Merah Indonesia, with double blood bags. The centrifugation ball that had been balanced with was placed into the centrifugation and then rotate for 30 minutes. Clamp and connecting hose between the main and the satellite bags were opened. Plasma was flowed into the satellite bag, and the connecting hose between the main and the satellite bags were sealed using an electric scaler and then cut. Platelet containing plasma from PME were frozen at minus 40 degrees Celsius for 12 hours. Then freeze, uh, then freeze dried for 48 hours using a freeze dryer machine. And then sterilization with gamma radiation doses 20 and 25 kilograms. This is method IPRF. 10 milliliter of whole blood without anticoagulant placed in plastic tube, centrifuged at 700 rpm for 3 minutes, and 1 milliliter of IPRF was collected from the upper layer. And then cell culture, human osteoblast cell line NG30, NG63, culture in T75 flash in incubator, 37 degrees Celsius in humidified atmosphere containing 5% CO2. And then when cell reach confluency in 80 until 90%, cell were trypsinized on visits in DMEM containing 10% FPS, and cells were centrifuged at 1500 rpm for 5 minutes. And the cells will settle at the conical base, then the DMEM is at and aspirated. So osteoblast cell were seeded into 96 well plate as much as 100 microliter, then were incubated overnight and treated. This is of osteoblast proliferation, and this is 96 well plate. Osteoblasts were seeded in 96 well plate with density 2,500 cells per well. Then treat with FDHPRP20, FDHPRP25, and IPRF. Then given of MTT assay, and cells were incubated overnight, and then read using an ELISA plate reader on days 1, 3, and 5. And statistical analysis, the data were analyzed using SPSS 24, comparison of mean optical density value from FDHPRP 20, FDHPRP25, and IPRF were carried out using two-way ANOVA and LSD post hoc test. P less than 0.05 were considered significant. And the result from this image, we can see that the number of cells increasing from day to day in FDHPRP20, FDHPRP25, and IPRF. A, this is FDHPRP20, and B is FDHPRP25, and C is IPRF. And from the image in day 1, day 3, and day 5, the cell increasing. And this is a picture from mean optical density. Thus, the mean of OD value, osteoblast proliferation, continue to increase until day 5 in FDHPRP20, FDHPRP25, and IPRF. So this is a summary of post-hoc LSD test result on osteoblast proliferation. First day or in day 1, no significant difference from FDHPRP20, FDHPRP25, and IPRF. But in day 3, No significant difference between FDHPRP20 and FDHPRP25, but there was a significant difference from IPRF to FDHPRP20 and FDHPRP25. And in fact, day or day 5, no significant difference between FDHPRP20 and IPRF, FDHPRP20 and FDHPRP25, but significant difference between FDHPRP25 and IPRF. And the discussion freestyling technique. Many benefits of the freestyling technique in PRP. This can suitable for maintaining PRP activity, maintaining platelet count and level of growth factor. And FDPRP can increase in vivo bone regeneration similarly to fresh PRP. And the growth factor bioactivity and its healing effect in FDPRP can be used in chronic wound healing. And there is a study reported that comparing single and multiple injection application in the one area of diabetic mice, FDPRP promote a faster wound closure when compared with non-treated group. In osteoblast proliferation continue to increase until day 5 in FDHPRP20, FDHPRP25, and IPRF. This is because growth factor in FDHPRP and in Nakatani research, PDGF levels were higher in FDPRP than FRESH-PRP, and Kinoshita et al. Reported that FDPRP can maintain PDGF pharmacological activity during 4 weeks of storage. This is PDGF can increase cell proliferation. So I think that this is make osteoblast proliferation continue to increase until day 5 in all treatment. And in first day, FDHPRP20 and FDHPRP25 had higher OD value than IPRF. I think that it's because PRP produce very high amounts of growth factor in the first 15 minutes to 1 hours compared to PRF. And the PRP release 70% of growth factor in the first hour. So I think that it is the reason why FDPRP 20 and FDHPRP 25 had higher OD value than FPRF. And the advantage of FDPRP are that it is easy to store because of its powder-like shape, easy to combine with other material, and if practical, want to immediately can use anytime. And the conclusion, treatment of FDPRP to osteoblast cell can induce proliferation. At the first and fifth day, osteoblast proliferation effect was no significant difference between FDHPRP20 and IPRF. So, this is my presentation about my paper about preset homologous PRP induced osteoblast proliferation. Thank you very much.